14, 15 years back, somebody, or maybe 13 years back, somebody asked me, hey, VS, यार तू अभी भी तेरा Corolla चला रहा है, Toyota Corolla चला रहा है, and Mercedes नहीं लिया. So I said, you come down to my clinic. I've got 2 Mercedes in the clinic. My equipments are worth, say around today, my equipments are worth probably 1 CR. The rundown value, depreciated value is probably 38, 40 lakhs.
Mm-hmm.
So I said, come and have a look at the equipments. I have a Mercedes there. I said, I remain in this place from morning 8:30 to evening 8:30. That Mercedes is very hell standing outside at such a high price I buy. It's standing in the sun. And in the night when I go sit in the car, others know that I'm driving a Mercedes, but I don't know which car I'm driving. So I have to reach home and halt it. So I said, understand the difference between want and need.
All right. Hi, and welcome to this amazing podcast. My name is Saurabh, and I have my partner Vishal from Grow Medico. And today we have a very amazing guest in this podcast. He is very straightforward. He's very smart. Let's welcome Dr. V.S. Mohan. Hi, sir. Welcome to this amazing podcast.
Thank you.
We have a saying, and if you want to win the business, it's just like you have to be the part of the conversation of the customer's mind. You just don't need to pitch them or sell them anything. You just need to be the part of that conversation that is taking place in their mind, and ultimately you will win the business. Not just win the business, you will win the person.
Absolutely. The very idea is not to win that particular thing in the patient's mouth at this particular time. That's a one night stand. I'm sorry. I'm sorry to say that and use that particular term, but then the fact of the matter remains is that it is not use and throw. It's not a tissue paper. That you want that particular patient to come back to you. You want that particular patient to speak well for you. You want that patient to tell 10 people that I went to Dr. Mohan, I went to him, I was sent to him by so and so, or my father or mother or grandmother or somebody was going to him, and then I'm still going to him. And at the same time, we also have to realize that you have to give him that space. You have to give respect to that person. However small, however old, however poor, however rich they are, that's immaterial. My job is I don't even know at times who my patient is. I only know his name because the name slip comes in. So I'll address you. Hi, Ross, how are you? Okay, how's the day going on? Yeah, fine. Please come on, sir. Sit down, sir. Ma'am, sit down, please. So my thing is that you have come to me for a particular work. I need to sort it out. Before I sort it out, I need to establish a connect with you. So it's by way of a story or by way of some kind of a connection. Once that connection and the rapport is built up between you and me, then in that case, you are mine. Okay? Because the reason is I always believe in one thing. I believe in myself first. That's why my initials are VS, very selfish. I don't care. But at the same time, I just follow what my teacher told me that, listen, Mohan, the treatment that you would suggest to your patient is a treatment that you would suggest to your mother otherwise.
I can really see the clarity in your mind that you're very much clear that what you want to do, what you want to achieve, and what you are doing.
Great journey, sir.
Yeah.
And we are a big fan of your voice.
Oh, God.
We are a big fan of your voice. Being from radio fraternity, we really like your voice and the way you speak. Even Vishal told me that he had a short call with you, and he was like, "Dude, I had a call with. He sounds totally crazy. Full on. इनको तो dubbing करनी चाहिए. क्या amazing." Then he told, "Yeah, even you have a connection with Rajesh Khattar, sir." So
yeah, we used to live in the same building. The building where I used to live, and I was the chairman of the building. Rajesh Khattar lives there on the 40th floor. Pepon, the guy who sang Asami singer, Moho Moho Ke Dage.
Yeah.
Okay, that guy lives there. Then one of the Kakkards live there. Arijit Singh has a flat there. Abhijit Sawant lives there. Tapsi Pannu lives there. So there are quite a few. Seema Biswas lives there. Lucky Ali lives there. There's quite a few people. And
amazing.
43 years back when I started my practice, way back in 1979, December. when I started my practice, I'll tell you something, we were absolute novice. We had no idea on what this practice is all about. Let me be very honest with you. To begin with, somebody might ask me, what made you get into dentistry? I'm very positive, excepting for very close friends of mine. Okay, rest will not agree. I still remember the day I set foot into the college. Okay, all my classmates, whom I never knew any one of them excepting one, all were sulking. Everybody was like as if they've lost a girlfriend or they've lost something from their wallet or something dreadful has happened to them in life. And they were actually clueless on what was happening and what they should be doing. Okay. And then when I came to them or I went to them just to introduce myself and to become friends, they said, "तेरे को तकलीफ नहीं हो रही है? You're not feeling sad." I said, "For what?" I said, "I don't have a girlfriend. I'm not lost a girlfriend. So I don't have one. So it's okay." तेरे को मेडिसिन में नहीं मिलना चाह? I said, मुझे नहीं मिल रहा था. तो बोलता है मेरा 1 मार्क से गया, मेरा 2 मार्क से गया, मेरा कैटेगरी अलग था, नहीं मिला. I said, 89 to 90% of the people sitting over there, this is what they all told me. It is a rejected mal where they couldn't get into medicine and they all landed up into dentistry.
Okay.
That was the plight at that time. Later on, over a period of time, in fact, I even made a statement. I wish I could do dentistry now. You know, the reason was during our time, 100 students in our class, out of that, 85 were guys, and my initials are VS. I'm very straight. 85 guys and 15 girls. And what do? You still go out and look out for girls. Okay. Whereas here today, 80 are girls. So I wish I can go back and do dentistry. I have a wider choice today. Okay, but things are different today. If you go to look at it, I really love the way the girls have come in because the career graph has to grow. We have to have an inclusive growth if all of us have to achieve things. You know, and I took up dentistry because of the simple reason my uncle was the first orthodontist in this country.
Okay.
I used to look up to him. After my mama came another mama, then came another mausi, and then I was fourth. After me were another 5. So we are a bunch of 9 dentists in the family.
So you have so much of experience into this field, and people like admire you, and of course there may be so many people out there who are starting their own journey and who keep on following up with you, who try to connect with you, and there are so many people out there. So I just want to ask you how to actually become a dentalpreneur.
First and the foremost thing is dentists have to really touch their heart and think that the different hats they need to wear. And these multiple hats come from where and what kind of hats do you wear? Okay, one is you are a clinician, you are the boss in the clinic. Okay, so you are an entrepreneur. Okay, you want to make the money. You need to have someone, you need to be an HR person because you got a huge staff. And now my staff is pruned down. I used to have a staff of about nearly 9 to 11 people at a time. And now it's just 4 of us. And then you have a couple of doctors whom you have to treat. You have your associates. You have your laboratory people who are supplying you with lab work, that's crowns and bridges and other things. You have your material supplier you have to deal with. You have to deal with the bank. You've got to understand finance. You got to deal with your chartered accountant. You got to deal with your other suppliers. So, and you have to also manage patients. Apart from all these things, you got to know what is happening the latest. Second, you can't, I'm sorry to use the word, please forgive me if it's an unparliamentary word, but then you can't be a moron, right? When a patient sometimes wants to talk something apart from dentistry, something apart from his tooth. So you also should know what are the current things, of course, without going too deep into any kind of political thing, because today it's a very highly polarized thing. So you don't want to lose a patient because you belong to X party, that guy belongs to Y party. No, My pocket has to be full at the end of the day. That's it. Okay. I have my register has to cling to the final thing. But all said and done, you need to involve yourself in some kind of a talk. So there has to be a connect. There has to be something. So you wear multiple hats. So this is where the dentists have to learn and also understand one thing. Okay, I think I can only do my clinical work. Now I need to know how to hire a person for HR. So he manages my staff. How to hire a person and how to train that person to order stuff, how to communicate with the laboratory, how to communicate with the patients. Because, see, it is not that you come into my clinic, I say, oh, come on, open your mouth, and I inject, I remove the tooth, put a piece of a big gola of cotton there in the mouth, and shut your mouth, go. No, I need to explain. I need to have the capability and capacity to convince a patient. Secondly, while passing on the information, you need to be understanding the patient, how much is he understanding. I know for sure people start speaking in the language that they are comfortable with. But is that patient comfortable with? The guy doesn't understand head or tail of what you're trying to say. I cannot tell them, oh, I'm going to give you a local lignocaine hydrochloride infiltration, and I'm going to take a blade and with a Bart Parker handle, I'm going to make an incision. I'm going to reflect this flap with this who the hell am I? Doc, listen, yeah, I have got a problem here. You got to do it. I have agreed to pay you a lakh of rupees, and that's the end of the matter, man. Whereas the same patient, you try to understand what his problems are. You try to do it. You try to do it in the graphic way. Okay, because as you always say, you always realize one thing: the medical representatives, actually speaking, come with a book and they show you the book. They flip that flip chart there over there. The visuals actually speak a lot.
A lot.
True.
And that remains here. That remains here. And when we write, it is on the pen, the medication, that whatever the medical representative has told us. The same way you tell the patient, show it to the patient. There are two things there. I explain it to the patient. At the same time, I'm protecting my back medico-legally. There's a lot that we all should be doing, and we can do it. So my thing is that, to be very frank, I really enjoyed my entire, what do you call it, as say 1975 I entered the dental college. So it is about 47 years now. And I have enjoyed every minute of it. And if someone asks me a question, without fail, even on a narco analysis, I will still claim I would like to be a dentist even in my next life if I get one, or if I have to face one. Because it's an amazing feeling, because in today's time, the technology has changed and we have lived through that particular technology. Can you believe I have myself done one gold filling?
Okay. This is crazy.
So that's why I said we have to wear multiple hats. Yeah.
As you have quoted that you want to live dentist for 7 janam, to be more precise. Yeah. So how in this janam, if we talk about in the current situation, how are you actually practicing it, and how are you actually trying to scale the current situation which you are into right now?
Okay. It's a very good question that you asked me. I wish I can give you a very straightforward answer with a straight face. I do go to the clinic every day, but I have reduced my work. Okay. And I just see about 8 to 9 patients a day. Okay. And I don't have an associate now. I do feel at times that I'm doing a wrong thing, because this is a payback time for me and I should be teaching somebody. I should do a proper hand holding. But somehow I do get a little bit flabbergasted and a little bit upset too early or too fast in today's time, maybe because of age. I'm just close to 66 years. So I do feel at times, but I have all the latest possible things in my clinic. So I somehow felt that it's not something which is, I mean, it's like the normal parlance, what you say. One shirt doesn't fit everyone.
Yeah.
It's not one size for all. Okay. Unlike somebody said, har bimari ka ek hi ilaj, anulom vilom. That's not something which is, I'm so sorry, but I don't want to quote anybody. Otherwise, somebody might file a case of defamation on me. I'm used to that. But all said and done, I've gone through everything in life. I've gone through everything in life. So it's not anything new to me. But all said and done, uh, we focus basically primarily on, say, for me, accepting Tuesdays and Saturdays, leave those days, and Sunday. Monday, Wednesday, Thursday, Friday, I use it for reading dentistry.
Okay.
I read articles, I read journals, I do write articles. I am a reviewer for a couple of journals. That forces you to read. You'll always find me eating, sleeping, drinking, dentistry.
Nice. Even in this
Amazing.
stage, you are
Yes.
doing it. Like, this is really amazing because we
Because
have some of our friends who are actually trying to get into the field. Maybe it is dentistry or cosmetology or dermatology, but they are like, यार कितना पढ़ना पड़ता है, you don't know dude, दिन रात पढ़ना पड़ता है, दिन रात एक करना पड़ता है, पता नहीं ये कब खत्म होगा, पता नहीं हम when we'll actually get into the game and when complete thing will rolling, and now
I will
you're
tell you.
putting this.
You said this. You said this. I will, let me just, not that I'm trying to pack my bag, but not in an irrational fashion or any other thing or a knee-jerk reaction. But I've always been considered to be by my friends as a aficionado, basically, the guy who goes and gets anything and everything. But I have that habit of studying things. I have the habit of doing things. The thing is that for me, it's been dentistry. It's been dentistry, and that's it. So the whole focus has been on dental. Second thing is learning new things and doing it. So when I finished my studies, okay, I had absolutely no clue. To be very frank, we were fortunate a lot to an extent. Let me tell you something. During my time, there is to be a composition, a standard composition. Okay, like in rainy season, अगर मैं बारिश होता तो हिंदी में composition आ जाती थी. Okay, and English में composition standard था, 7th standard या 8th standard में one or 6th standard. I'm not sure. Standard composition. You can't miss it. You can't avoid it. Okay. It's like I'll give you a surprise test, and that composition would be nothing other than whether science is a boon or a bane to mankind. Okay. So if you really go to look at it, and there is to be one small radio in the house, and that radio, you had no right to touch the radio. By any chance, if you just shift that knob of the radio, and if it gets slightly that, whatever that kata
frequency
you call it,
थोड़ा सा
and थोड़ा इधर उधर हिल गया वो बंद हो जाएगा. फिर उसको ऊपर से हम मारते थे. ओके, सच्ची में ऊपर से मारते थे. That we had the luxury of having it only for Binaka Geet Mala on every Wednesday at 8 p.m.
Okay.
Otherwise, if you're lucky and if you're a good student, maybe you could hear Vivid Bharati. Okay. Otherwise, the oldies in the house at that time, at 9 o'clock, 9 p.m. sharp, it will say, "This is All India Radio. Please stand by for the news in English." And that used to be Amit Sayani. And Amin Sayani used to be the one. And he was my role model right at that time. I used to love his voice. I used to adore his voice. I always thought I should meet him in life, but I never got an opportunity to do so. But that's what we were all used to. So the thing is that for us, it's been study. So even today, as I said, we wear multiple hats as an entrepreneur, or as your HR guy, or as your this thing, or maybe a hiring guy who hired the right person in place. And one thing is there, the focus is very much there. And that focus, let me just, if it's okay, if I can give advice is free, okay? Let me, I always jokingly tell my patients, I say, listen, yeah, who told you root canal is painful? He said, no, my neighbor told me. I said, what is his name? So some man's name, okay? Now, I said, you can even ask him about pregnancy. I think he can even guide you on that. And I do it with a very straight face. Very straight face.
Again, your initial is VS. Very straightforward.
Okay, it might appear very silly, but I think it is a very, very sweet way of putting it across. So the fact over here is that we had a group of like-minded people, and 10 of us or 14 of us, we used to sit together once in 45 days.
Mhm.
We used to miss our practice, go and sit there, all of us in our prime of practice, all of us seeing 25, 30 patients a day. There was a time when I used to see about 40, 44 patients a day. But we all would decide a date, and 45 days after from today, we'll all be there at about 6 o'clock.
Mhm.
Some of us would smoke, and by 6:30, 5:45 we used to be there. 6 go in till 9 o'clock. Until that 6 to 9, other than tea, coffee, or maybe a cold drink, no hard drinks will come. And no wafers also would come because somebody might make noise while eating. Okay, so we were that strict. And only discussion on dentistry,
Mhm.
dentistry, dentistry.
Okay.
There is no external competition for you. You can only compete with yourself. So that threat perception was not there at all. We always felt that we cared for each other, so we shared everything between
Mhm.
each other. So that concept was there. So we could learn, we could go ahead, we would help each other. Second, I still remember, say about 14, 15 years back, somebody, or maybe 13 years back, somebody asked me, hey, VS, यार तू अभी भी तेरा Corolla चला रहा है, Toyota Corolla चला रहा है, and Mercedes नहीं लिया. So I said, you come down to my clinic. I've got 2 Mercedes in the clinic. My equipments are worth, say around today, my equipments are worth probably 1 CR. The rundown value, depreciated value is probably 38, 40 lakhs.
Mhm.
So I said, come and have a look at the equipments. I have a Mercedes there. I said, I remain in this place from morning 8:30 to evening 8:30. That Mercedes is very hell standing outside at such a high price I buy. It's standing in the sun. And in the night when I go sit in the car, others know that I'm driving a Mercedes, but I don't know which car I'm driving. So I have to reach home and fall dead. So I said, understand the difference between want and need.
Mhm.
So in the same way, in the clinic also, I would like to only tell my friends, my colleagues in the field, that listen, you are what you call it as going to analyze your own practice, take a stock of the situation, understand the geographical location you are in, the type of clients who are actually coming in, the type of treatment that is being done. Whether that is the only thing you understand, then upgrade yourself.
Mhm.
But if they are not coming for that kind of treatment that you have, then having this kind of an equipment and having that kind of an equipment is only going to be a drain on your pocket without anything coming towards return on investment.
True.
If you can't evaluate your own practice and you can't just emulate somebody just because your friend, let's assume in Warden Road or Bullabai, there's Desai Road, or in Bandra near Carter Road, okay, he's getting some clientele and he's in a position to have some new gadgets in the clinic, which is making him money, which is giving him the footfall, which is giving him that kind of attracted patients towards it. Then he can afford to have it because he's gaining something out of it. Here we need to evaluate. We can't, okay, but at the same time, you can't remain back in education. You can't be less informed. At the
Mhm.
same time, even if you are not doing it, you know who's doing it. You can at least call that guy, give him
Mhm.
business,
Mhm.
generate business for yourself, rather than saying, oh, I cannot do this procedure, but I'm not qualified to do the procedure. Whereas you can always do the procedure through somebody. Give him some money, keep some money for yourself because you are giving him the patient, you're utilizing your clinic and your other things. So you make your money and at the same time learn and attract patients. Like I went for a course on digital dentistry.
Okay.
So somebody asked me, sir, I said, yeah. I said, I'm going to become a member also. क्या sir? आराम करो ना sir. I said, I'll have my drink when I go back. It's a Sunday today. But then I said, listen, why? Why can't I learn? I said, and if I can do it, I will do it. And I have the provision in the clinic. I have the hardware there. It is only a software. And even your phone, you have to keep on changing the phone and you have to keep on upgrading the software, right?
Yeah.
Now, you have to. See, listen, if you don't, then you are left behind in the race.
Mhm.
And not only that, getting behind in the race or being left behind in the race is not my problem. My problem is, am I denying something which is rightfully my patient's by my lack of knowledge? Am I preventing him from having it?
Yeah.
So if that thing opens up in our head, then you know, okay, my patients have to get the best. Even if I don't know to do it, be honest with the patient. Sir, I don't know how to do it. I have a
Mhm.
friend of mine who does it, and I'll get it done for you. Responsibility is mine. I'll tell you something. The patients get floored. They go out and say, Mohan did it. I've had a friend of mine who told me, hey, for my uncle, you had done this kind of an implant. He said, me and doing that implant. I'm not that skilled. I'm not an oral surgeon. He said, no, he told me Mohan did it. I said, oh, that guy. I said, so and so had come and done his implants. Oh, acha. No, this is what, see, the thing is that you have to know what's available.
Mhm.
See, at the same time, okay, don't misunderstand me. I don't want a patient to come to me. Sir, Google में बोलता है ये ऐसा है.
Mhm.
हम बोला, yeah, listen यार, Google का पढ़ के आया ना, my consultation goes to $2,000. अभी internet देख के दो article भी, in between 3-4 months back, 2 ladies came with one internet article. Okay, they said this thing can be used, sir. So I said, please. I said, just read the last 2 lines. And they read the last 2 lines. I said, more studies are needed.
Right, right. There are so many things on internet, and because of lot of unorganized information on the internet, people try to educate themselves all by their own, right? So according to you, what exactly is a good candidate of dental implant? Who should actually think that, huh, I need to get a dental implant, right?
In fact, Thursday, yeah, right? Today is Friday.
Friday, yeah.
On Wednesday, I had a group of about 5 students who sat with me on a Zoom platform.
Mm-hmm.
The thing is that they asked me. I said, my first question to you is, did you ask the patient, how did you lose the tooth? All the 5 clinicians looked at my face. There are salivary glands in the mouth. All the dentists have a major problem. Once they find a patient coming in, couple of areas teeth are missing, implant is the only answer for them.
Mm-hmm.
That's a good money. For me, it's around $50,000 profit in about 20 minutes. As you rightly said, that I think even in your sleep you can put an implant. And I think with the kind of staff that I have today, I'm not in a running race at all. Okay. But this morning also we placed 3 implants, but I took about an hour. But one implant generally is 15 to 20 minutes for me.
Mm-hmm.
But this morning it was slightly a sloppy case, so we did have a problem. But the fact is that every patient is a good candidate. There's no harm. But provided they have good bone, at the same time, you come to know why they have lost the tooth. Why did I put that thing first? The reason why I said that is you can lose a tooth for a couple of reasons. One is bad oral hygiene. Okay? You can lose a tooth. You don't have to remove it. They have bad gums. They have bad bone. They are the worst candidates for implants. If they cannot maintain their own natural teeth,
Mm-hmm.
how will they maintain that? Who told
Mm-hmm.
them that a natural tooth can have a gum disease and an implant cannot have a implant disease? It can. So if you really translate that, the gum disease, which is called as periodontitis, the donta part is the tooth and peri is around. And an implantitis, it is peri-implantitis. It is around the implant, you will have a gum issue. So if this guy cannot maintain oral hygiene, if he cannot stop smoking, if he cannot stop eating his pan, parag, whatever masala it is,
Mm-hmm.
then he is the worst candidate for it. Understand the reason why he is lost the tooth. Second thing is patients who are just out of the cancer treatment with some kind of a medication that they undergo. People who have some kind of bone diseases. Patients who have uncontrolled diabetes have no intention to control. They are the worst candidates that you can ever have. Other than that, is we are the worst people at times because we get start salivating and we start feeling, oh, now this evening I can take my girlfriend out for a good movie and a good dinner somewhere, and I can make some money, buy her a gift, and let me place 2 implants. I'll tell you something. This is the worst thing. So I always tell my students 80-20 formula. 80% sit in your cabin, take the drawings, look at the radiographs, look at the scans, look at the model, plan your surgery. And when you're doing this, all the 3 staff. Today, as I said, we have very less staff. Previously, there was to be 2 receptionists, so we never used to involve them. But we used to involve them in the planning so that they are in a position to talk to the patients. Okay, but all the other 5 chairside assistants, the 1 doctor, they'll all be there with me when we are planning this particular treatment. I always say, if you don't plan, you have definitely planned to fail.
Just want to know if we see in this today's era, like what is the role of like educating about the dentistry, not to the dentist but to the patient. I'm talking about the awareness and using social media to spread that awareness. So what is your take on that?
Let me put it in a slightly different way. I've always been called as an antisocial guy. Okay. So I have absolutely no knowledge of social. Facebook, Twitter, Instagram, whatever, LinkedIn, YouTube, whatever it is, blog. Blog के जगह पे मेरे को बोक सुनता था. मेरे को हमेशा book लगते रहता. But the fact is that in the old school of thoughts, our board used to say dental and dental X-ray clinic, and that's it, pure. Over a period of time, we realized that, okay, we need to, be there. Mm-hmm. And if you have to be there, you have to understand where you have to be. I was so lucky and fortunate. If I met you today, it is because of her. Okay. One, Dr. Anisa Shoaib Patel. Okay. Or Shoaib Sheikh, I think, or however she writes her name. Anisa, she's married to Dr. Shoaib. I happened to bump into Dr. Shoaib for a very different reason. He landed up in my clinic, and that's how I knew him. And casually, he did mention. Later on, somebody did make a mention to me saying that Dr. Anisa, husband, Shoaib, it was, who had come to you. Okay, I said, okay. I said, who is this Anisa? So she said, that girl is also a dentist, sir, but she does a lot of programs educating the dentist how to, market yourself on all these social medias. So I said, is that so? Okay. So then finally I said, okay, I called up Shoaib. I messaged him. I said, listen, I need your wife's number, Anisa's number. By that time, this girl had sent it. So he said, I'll give it to you, sir. I said, okay. He said, no, I need to talk to her. So immediately she called me back and she said, sir, how are you, sir? One good thing and bad thing is, like, a lot of people know you. So I cannot stand at the corner of the road and have a smoke also. A lot of people know you. Okay. So the thing is that very unfortunate thing. I can't even go out with my girlfriend because I get noticed. So, but all said and done, I told her, I said, I would like to meet you whenever you have the time. She said, definitely. And then she came and started. I said, listen, you are trying to educate me and you are at a different level. I am at no level. Why don't you try and put it in simple language to me? And before that, I will tell you what I do, how I do, what I know, what I don't know. My cards are open. She took it up. And today, where I stand in the social media circle with some of my stories, of course, the stories have been given to her. She's, of course, given it the leverage and taken it at that level. One of my stories that is doing the rounds is, I think, has had about 15,000 people looking into it. And how I completed my post-graduation, basically. So she was so good enough in doing it. So all thanks to, in fact, I should thank Shoaib because he came and met me. And then I need to thank Anisa because she took it up. And I found someone who's very affable, very loving, caring. Today is the time where people should be made to be aware of. There is something called as internal marketing, and there is something called as an external marketing. The external marketing we all thought were two things. One is our word, which is hanging outside, and one is the word of mouth, okay, from one patient to the other patient. So, social media is a mandatory requirement for all the younger generation today. If they want to generate leads, if they want to give their knowledge in a format that patients understand, pictures in a format that they understand. No patient wants to see blood there. No patient wants to see some back tooth there. No patient wants to see stitches being done or a video of a sutures being put. That's okay for an educational purpose for your colleagues, your fraternity. That is fair. As an educator, as an instructor, as a person who's passing on knowledge for a newer technique, newer technology, fair enough. But for a patient, you can show that new technology and say, okay, this is the use of this newer technology. And that gives you precision. And that's a mandatory requirement. Yeah, if you had asked me 3, 4 years back, I would say, hey, what is this social media? I don't understand it. What do you keep doing on your Facebook? What is it? What are you updating? Yeah. See, the information has to be in the right way to the patient. So the doctors also should have the knowledge, and we should give it in the right way, and also give that pictorial thing. We have a lot of things where animated videos go on. We don't show the surgery to the patient. We do take pictures. While taking pictures, we are very strict. No blood should be seen there. It should look as if it is a bloodless coup there, actually. Okay. And that's how you win the patient over. Patient doesn't want to see the
Exactly. If they see some blood on the photo in social media, then they might be scared of doing implants.
Absolutely.
Or
Absolutely.
they may be scared of doing any surgery.
Very, very true. And we have one more thing that we do is call the patient, say maybe 4 hours after the surgery. Call the patient, surgery is over, everything is fine. Are you all right? But that is done with a very selfish interest because I need to sleep at night. I don't want somebody to call me about 9 o'clock and say, hey, doc is bleeding and this and that. So go and attend to him at 6 o'clock itself and there ends the matter. So that's a way where patients also say, doctor, it's so nice. I've never had a call from anyone. Another thing is, I would only want my friends over here to realize if they listen, whenever they listen, is that we all today follow the social media. All of us want to do something on the social media. We were even told take reviews and take a feedback. You should do that. But can I ask them one question? Do you do a feed forward? I'll tell you something. 99.99% of the people have looked at me as if I spoke some bad language. They have asked me, what is that feed forward? I learned that feed forward in a very dramatic way, I would say. I used to go from Andheri to Thane and for performing surgeries. One fine day, I said, let me just go here to this particular restaurant and have my food. Okay. And so I went there and had food. And when I went there, the first thing is that guy gave me, this small cotton buttons like thumb, and you pour water and it starts swelling up. So the hand towels. So I used it and then realized there's perfume. Now with a pretty perfume in your hand, you can't eat.
Right.
Okay, if it was after I had eaten, if he had given me that perfume one, it was all right. But not now. So I had to get up in a half and I said, yeah, you spoiled my mood. And I went and washed my hand. After all, Indian, we got to eat the chapati and the tandoori roti and naan with your hand here. So next time, again, it so happened that I went there and I said, okay, let me just see. I said, some other restaurant. By that time, somebody knocked and it was a Merc. So that guy recognized and he knocked on the window. So he said, Sab, andar aaiye na. So I said, नहीं यार तुम्हारा रेस्टोरेंट में खाना नहीं खाना है मेरे को क्योंकि वो परफ्यूम वाला वो अतर इतर लगा के देता है तुम वो खाना कैसा खाएगा आदमी इंसान है कि मैं क्या है ओके तो he said, sir आप प्लीज अंदर आइए. You won't believe. I went inside. I had two things. I didn't have to pay the bill. But the thing is that I learned something from him. सब में सीख है, हर चीज में एक सीख है. He said, "Sir, manager wants to talk to you." The manager said, "The owner wants to have a word with you." I said, "Do I look like a wanted guy or something?" So he said, "Sir, आपने एक सजेशन दिया था, हम आज वो सजेशन फॉलो कर रहे हैं. पहला आपको जो टवल दे रहे हैं उसमें परफ्यूम नहीं है, लास्ट में जो दे रहे हैं उसमें परफ्यूम है." So that means you also feel you're wanted there. Somebody has taken up a good suggestion,
Right.
and he has also thought about it. He has done some kind of chintan manthan, whatever it is, self-introspection he has done. And he has arrived at a stage where he has realized that there was a mistake. So there are instances in the dental clinic. That's why we always tell our staff, only when the patient sits, वो आसन ग्रहण करेगा, उसके बाद उसका कप रखो, पानी का कप, नया कप रखो. Otherwise, I'll tell you something. 50% of the patients ask you a question. पहले वाला patient है ना, निकाल दो सर, नया लगाने बोलना. This is only 50. Don't think that other 50 have not asked you. They don't want to ask you. Because they feel हमारे डॉक्टर को जरा सदमा पहुंचेगा. So all the 100 people want to ask you. But only 50 put up that question in front of you. So we have to realize that. We have to understand that. So there are a lot of things in dentistry that we take reviews, we take these things. But ultimately, what do you do with it? You have to work on it. So there was a book called Change Your Smile. So it's like a coffee table book. I used to keep that book there. And every patient is to come, take that book and read that book. And then patient is to ask, okay, oh, nice, doctor. ये आप किया है, ये आप किया है, that kind of a thing. So then we start looking into, yeah, I can do this. I can do this procedure. Then one patient asked me, ये तो विलायती book है sir. ये तो दूसरा किसी का काम है. That's the time it opened my eyes and said, oh, I have to now buy a camera, do a before and after picture of my own patients. Of course, I need to put a putty on the eyes so the patient's face is not seen by you, but at least I have to put it. And when I keep that photograph over there, that made a difference.
Okay.
So the social media is a very important tool. I would say, yes, use it properly, judiciously. Okay. Things will work. Things will work. And you should know your strength. You should know whom your target audience is. You should know where you are projecting it. You should know which area you're practicing, whom you're trying to attract. Is your clinic well equipped for it? Can I say that I serve first class, 5-star, 7-star food in this place and it is a dhaba on the road? I can't afford to do that. I need to have a proper ambience for it. I need to have a proper setup for it. I cannot have somebody get chai for me with his finger inside. Chai ka glass aisa leke aage aisa rakhega. I can't think of charging him $500.
Yeah.
Okay. I'll give him only 5 rupees. Ungli ke sath aur kya milega? 5 rupees milega. So we have to realize one thing. There are a lot of people who say, oh, his charges are more. Yeah, right. I agree. You also want to be like that. You also want to emulate. So then follow that to the hilt. And also understand where you are coming from. Set your priorities right. You prioritize your life. Okay. You can't do something just because samne wala kiya. Okay. So you have to understand where you are basically looking at and what you are trying to do. So one has to scale up their practice. One has to go and retain those patients who are still with them. Retention is also important.
Wonderful. So much value you have initiated and you have shared in this complete podcast.
You basically have the ocean of knowledge. I mean,
it's a question of trying to improve your own self at every stage.
Yeah.
That self-realization when it comes, and when you want to have a self-esteem, and when you don't want to be called as a fused bulb, and you want to be relevant. Okay.
You have added immense value in this complete podcast. and we're really glad that you came into this amazing podcast. And I hope even we asked you relevant questions, which even you, of course, enlightened the complete podcast in that manner.
Vishal and Saurabh, you've been excellent hosts. And moreover, the way you guys connected with me and the way you spoke to me gave me that kind of a feeling, yes, I can do that. And the encouragement that comes from your side also makes a lot of difference.
Yeah.
The vibes that you get from an individual also is equally good. But at the same time, your questions were so relevant and eye opener for me also. Even at times, I had to dig in to my own, what do you call it, as book inside me to find out whether I'm saying the right thing and whether I can say it or not.
Mhm.
So it's also a thought provoking exercise that today my brain has undergone. And it was a nice thing to interact with you, and more so with my own country cousins, I would say, Nagpurians. So January, I'll definitely meet you. I
Arre
don't
wah.
remember the dates. January, I'm there in Nagpur,
Acha.
and
Amazing.
yeah, because we have a ISOI conference, so I have to be there. But I really thoroughly
Right.
enjoyed myself. That's it. Thank you. Thanks a lot. I really enjoyed.